The paleo diet could cut your risk of a heart attack in just 8 weeks, new research claims. Within 2 months of living off food that a caveman could eat, participants in a new clinical study saw a dramatic improvement in their health. The findings will be presented at next week's National Heart Disease Conference. It would be the first major study to show concrete benefits of the diet, which has been popular for decades. The study by the University of Houston Laboratory of Integrative Physiology involved 8 healthy people. All of the participants, who normally eat a Western diet, switched to the paleo diet. The diet is based on eating foods thought to be available to our ancestors during the Paleolithic era, before the advent of dairy or processed grains. The participants received a sample paleo diet menu, a recipe guide, and some advice on how to incorporate the diet into their everyday lives. They were told to eat as much or as little food as they wanted during that time. All 8 of the participants experienced a 35% increase in levels of interleukin-10, IL-10. IL-10 is a crucial molecule produced by immune cells that combats inflammation and provides protection for blood vessels. Previous studies have shown IL-10 levels dip when arteries are inflamed. As a byproduct of the experiment, the participants also lost weight. On average, they each consumed around 22% fewer calories and 44% fewer grams of carbohydrates on the paleo diet. This preliminary feasibility study did not include a control group of people not following the diet. That makes it difficult to determine if the changes observed in inflammation biomarkers resulted from specific food choices, reduced calories, fewer carbohydrates, or weight loss. Further research is needed to corroborate these findings. But the study has been recognized as a key first step. Very few studies have examined the paleo diet in seemingly healthy participants, despite the prevalence of this dietary practice in health and fitness enthusiasts, said study author Chad Dolan, a researcher at University of Houston Laboratory of Integrative Physiology. This study's findings add to the possibility that short-term dietary changes from a traditional Western pattern of eating to foods promoted in the paleo diet may improve health, Dolan said. At the very least, the diet does not have negative health implications in terms of the parameters we studied. If our research continues to show that the paleo diet produces detectable changes in healthy individuals, it will substantiate claims made by those supporting this diet for the past few decades, and providing preliminary evidence for another therapeutic strategy for cardiovascular disease and coronary artery disease prevention.